Busoga Health Forum Continuous Medical Education Sessions. By name, Robert Mokembo. I'm a resident. I'm a resident of surgery at Mbarara University, but I work with Gulu University as my employer. At Busoga Health Forum, I work with a senior consultant, Dr. Kabweru, in the CPD coordination section. I want to thank you again for tuning in every Friday. Those of us who have been consistently joining, I want to thank you. Get a point. Always be with us every Friday, 8 p.m. to 9 p.m. for these educational sessions. I equally want to welcome new members, those of us who are joining us for the very first time. We want to thank you for choosing to be part of Busoga Health Forum, and specifically to assure you that we are here with you, we are here for you, and we are here to learn from you, and we are here to help one another. Kindly keep coming every Friday, 8 p.m. And please don't be just a passive participant. If you have an interesting educational presentation you would want to present to the audience of Busoga Health Forum, kindly reach out to me in my inbox on WhatsApp or by email, or in whichever way you can locate me. At least in the medical field, I am a bit, I should say my number is a bit common in very many areas. So you can reach out to me and be sure we will be able to help you and schedule you. We will also like to invite organizations. You might be a health facility, you're a company that deals in health services or health-related section. You might be a pharmaceutical company. You have a new molecule or product you would want to share with Ugandans. You might be an organization dealing in community health activities, and you have something you would like to share with the health workers. Maybe to make it clear, Busoga Health Forum does not only cover Busoga region. You can see I'm in Mbarara, but I do subscribe to Busoga Health Forum. I work in Gulu, I subscribe to Busoga Health Forum. My senior Kabweru works in Mulago Central Region, he subscribes to Busoga Health Forum. So you can join us from everywhere. We reach to people across the world in South Africa, in America. There are people listening in from UK. There are those listening in from China. So we are across the world and across Africa, across Uganda. We do not discriminate and we do not underrate anybody. As long as you have information that can help us improve health services, not only in the Busoga region, but in our country, Uganda, because as we listen or as we educate, we empower all health workers. So come in with those educational trainings, maybe a breakthrough research. You might be having a molecule which can change people or people have not listened or heard about a lot. We are here to give you that audience at Busoga Health Forum. And as we begin our new year, we will also be sharing our calendar. I think, Mr. Desmond, you can organize that calendar that you can share at the end of the session to show our members we have a work plan for this year for the different topics or areas we will be covering every month. And you can choose to schedule your presentation in any of those. Every Friday, we will give you audience, and where need be, sometimes we can organize the CMEs twice a week according to availability of presenters. Please feel free to contact us anytime you have something you want to share with us. And before I invite the presenter, I wish to, in the same vein, as I say, Happy New Year to all of you. Since this is our first CME this year, please make it a point to be an active member of Busoga Health Forum. Join us. Usually, as we said, subscription is open. You can pay as much as you can. The payment is not by force. You are voluntarily supporting activities of Busoga Health Forum. For example, this activity of CME, we need a link, a Zoom link, which is unlimited. But those of you who are in digital network, you know that costs you more than $1 million or $2 million to have such a link hosted. So well wishers like you, when you subscribe, you help us get that money. We incur data costs, we incur money in activities in the field. We reach out in health centers and do CPD activities like these ones. We conduct health outreach activities. We do capacity building programs. We engage health workers in communities. So there are several activities we do. You can check out on our website, or you could physically visit us on Gabla Road in Jinja and have an interaction with our CEO, Dr. Changwa Moses, or you could visit our professor, the chair board, Professor Waiswa Peter at the Makerere School of Public Health, or you can reach out to any of us. We can take you through Busoga Health Forum programs. Ladies and gentlemen, that was just a preamble to welcome you to our CPD annual program, and as well to say Happy New Year to you. Once again, I'm Robert Mokembo, who will be your host, your moderator tonight for this program. And in-house tonight, we will be discussing something pertinent to and central to healthy practice. It is a new year. It's a new year. Sorry, I had an interruption. It's a new year, and all regulatory councils are renewing practicing licenses of health workers. And that means we need health workers who practice with the right attitude, health workers who are practicing professionally, and those who observe medical ethics. Some of us have fallen prey to unethical behavior, and that is not good for your professional growth and as well for the people you serve, the public. We have the Nurses Council, you have UMDPC, you have Allied Health, you have Pharmacy Board, and these are regulating the different health workers. You do not need to fall in their hands. So tonight, the topic of discussion is pertinent to all of us as health workers. And the person taking us through is a seasoned bioethicist who holds a master's in bioethics from Makerere University. He also has a master's in business administration from ESAMI. This gentleman is a senior consultant surgeon who heads the head and the thoracic and vesicular surgery department of Mulago National Referral Hospital. He is also a honorary lecturer of cardiovascular surgery at Makerere University, both undergraduate and postgraduate medical studies. The gentleman before you has before been an associate consultant at Naguru Regional Referral Hospital in Kampala. Currently, he is a senior consultant surgeon still in Mulago National Referral Hospital. Dr. Wilberforce Musoga Kabweru is also the vice president of the Uganda Medical Association, and previously has sat on several ethics and professional boards and research and training boards. He has a long CV that I may not exhaust tonight, but just know we've chosen to give you the best person to give you a training or education in this particular topic. Dr. Musoga Kabweru is also a proactive person in terms of professional practice and conduct, and is a trainer of medical practitioners and as well a mentor to so many people. Ladies and gentlemen, join me to welcome Dr. Kabweru Wilberforce to take us through ethics and professionalism in medical practice. Dr. Kabweru, the audience is yours. Thank you.
Thank you very much, Dr. Mukembo. You let me know whether I'm audible enough before I can continue?
Yes, Doctor, you're audible.
Yes, you are very audible.
Okay, so thank you very much for that humble introduction. You have left me bare that now every people know even my passwords and everything. But thank you very much, Dr. Mukemba. I'm really honored, and thank you, Benja. I want to thank the people who have logged in this evening to listen in as we discuss the elephant in the road. Why so many people sometimes their facilities have been closed, why their licenses have been taken away, why some have been expelled here and there, why some have been warned by the councils and whatsoever. So today we want to discuss ethics and professionalism in the medical practice. I'm going to tailor this to the Ugandan setting because we know that actually we may be having almost, some are universal things, but then we have those that actually are contextual in our setting. So the presentation I will follow through as it appears on the PowerPoint. We can proceed. So what is ethics? Today we are talking about ethics and professionalism. But I think ethics is the study of morality. And this involves actually the reflections and analysis that someone may put on something using ethical theories and ethical decision frameworks, and it shapes or it tends to shape people's behavior. So ethics tends to give you that privilege to rethink and redirect and reason out and see how best you can offer your services to the clients. Ethics is very general, and if we look at what is morality, those are the values or norms that are held by specific people, and they may be towards a certain way how you present yourself, but some of them actually cut across so many ethnic and then so many regions, and some of them may be in particular areas. For instance, the way when you are in Uganda, I would say that kneeling is very important. When you move to other parts of this country, the same country, you greet and you don't need to kneel. When you go to other outside Uganda, you may actually bend forwards and someone knows you're greeting them. And the way sometimes people do things may depend on their cultures. So morality tends to enable you to behave in a specific way. But it goes along to differentiate between what is right and what is wrong, what is fair, what is not fair. Because, for instance, if you're a doctor and you admit your relative and you admit other patients and there's only one vial of ceftriaxone and both of them need, in most cases, most people will think I should give it to my relative. But if it is Dr. Kabweru, he may do the very different thing. I can buy for my relative and give the other to the most vulnerable. But that takes somebody of a different caliber to make that decision. So today we shall be discussing medical ethics, how it shapes us as students, as practitioners, and retirees, and as other people. So medical ethics is a branch of ethics that deals with the moral issues that usually, these I could call them moral cross sections or moral crossroads that you meet, and they tend to give you what to think. For instance, when you're a doctor on your ward and you get your relative there with an HB of 4, and then you get the relative of a director on the same ward with the HB of 4, and anyway you get a patient from Chukubamutwe, the HB4, who would you give the 1 unit of blood that you have? And whom would you deny? That is what medical ethics actually tends to ask. Sometimes there are no very straight answers, but it takes someone with a lot of integrity and what to make a decision. So these are the dilemmas that we're discussing, and these are the things we shall be discussing tonight. So even when you are highly skilled, knowledgeable, and competent, I want to let you know that actually you need to be and remain ethical and professional, even during your training, your practice, and even when you retire. And there are so many examples of people we can look at who have exhibited this. So if other people have done it, we are learning how can we try to do it. So what is the essence of medical ethics? Doctors have to deal with medical challenges or responsibilities or dilemmas that actually may come as a result of some special situations. For instance, during violation of human rights, this is a number of things. Sometimes doctors actually see colleagues whose rights have been violated. For instance, patients who have been tortured, with those ones who can present with either like healed wounds in the back, the entire back, or who have been told to sit on charcoal stoves, and those who have had a lot of other injuries, even psychological trauma. Some people who have been raped and they cannot easily disclose. Yeah, and sometimes when they disclose to you in confidence, it can also torture you a bit. It is psychological distress, but the other person you don't want to make them to go through the same post-traumatic distress. So you really held between a hard rock and rough surface. Sometimes your clients may have criminal abortions, and you really don't want to sing over it, and they may not tell you directly, but as you examine, you identify that you are meant to give them the best service you can. People who are incarcerated, we have had colleagues who are behind bars for a long time, and those people actually we need, as doctors, you need to come out and say their rights shouldn't be violated. Sometimes not very easy. It takes someone with very strong stamina to make those decisions. So medical ethics tends to prescribe higher standards that
Dr.
determine
Kabweru,
people's
can you be a
behavior.
little nearer the microphone and we get you more clearly?
Is that better?
That's better.
Yes, and actually, medical ethics tends to prescribe higher standards even beyond the law. And let me tell you that where the law ends is where ethics sometimes starts. Although even during the law, there is a lot of ethical concerns that needs to be sorted. But ethics goes beyond the law, that it goes beyond demanding for the correction of laws that actually promote unethical behavior. For instance, if someone murders some other person, in law, they will defend and say it's right. But ethically, it's very wrong. Although even those that have murdered and come to your unit, or who have stolen people's things, thieves, you don't deny them the what? You don't deny them the services. You give them. But you don't need to say, oh, me, if a thief stole my car at home, then if I find this one who has stolen chicken on the road, I don't attend to them. No. You need to, don't even remind them, don't even tell them, and don't just pretend you don't know and treat them. Give them the same treatment like others. Even when they have also hit you with an iron bar the evening, and then you are in a car right, and when you wake up, please don't deny them the right to get services. So it is universal observed, and actually it is a standard practice during our training as medical students, clinical practice, and also during the time when you're conducting research that involves human beings. And this is known world over. So you can proceed to the next one, the next slide. So what is the importance of medical ethics? It prepares you as medical practitioners to identify or recognize the difficult situations in the clinical setting, research, and other practices, and it gives you approaches in which you can rationally and principally practice, so that at the end you are not told by the Uganda Medical and Dental Practitioners Council, the Nurses Council, or applied, or Uganda Health for our colleagues, or even the pharmaceuticals, so that even police has a standards unit, police standards unit. Even the teachers do. So we don't want to be held outside our confines. So it is important to be like your guide, your compass. But also it teaches the basics, how doctors should interact with other people, especially the patients. And some of these are engraved or found within the patient's charter. And it teaches you how to respect persons. And then during the time when you are taking the patient or some other person through informed consent, and it teaches you to keep most of the information confidential. So don't forget these things and do what you think. It shapes the way doctors relate to patients, relate to families of patients, relate to the community and other colleagues, especially when they are dealing in the, what we call shared decision making, where you need to involve a number of multidisciplinary colleagues in the different specialties. And it is through these ethical consultations approaches that you actually come up with a formula how to manage special situations. For instance, a child who is 6 years, we know we are starting school on Tuesday or Monday. Maybe if a child was going to school 6 years, knocked by a car or a boda or a motorcycle or a bicycle, brought to Mulago pediatric unit, and later on, this child is diagnosed with brain death, and this child is still, other organs are still normal, and the parents actually, even you demand to put the patient on a ventilator. Then under those situations where you have a futile diagnosis, what do you do? You know that this ventilator, this person is going to be there until other organs stop. They may take long to stop, but remember, the brain is not going to recover. And you know, you cannot tell the family that this person is brain dead. Now our setting here, the law is not very clear. What do you do? Those are the things we are going to be discussing tonight. So it also helps you as doctors to interact with the society and even your colleagues at a collegial level and the other government departments, agencies. Like police so many times brings for us patients. But are they meant to consent for the patients? No. They bring the patient, and if you ask them to consent, they'll say, me, I found the patient in the Kabweru, and I brought here on police Kabangali, and you are meant to continue giving the service to save the life. What about courts of law? When they ask you to provide information for patients, do you lift the entire file and go, or you summarize? Sometimes even when you give them the file, can they make out things? Those are all ethical challenges and dilemmas. So ethics is fundamental, especially when you are doing your clinical work and medical research and in training. So let us be cognizant that this is something that we are going to live with for the entirety of our life. Proceed, Benja. So, but as we are talking about ethics, I want also to drive in this professionalism. Professionalism comes from a simple word. Benja, I've run very fast. What is to profess? It comes from a word profess and professor. Before you go to a profession, so professing is like expressing your views, but then a profession, it goes beyond. It is like whereby someone is skilled or is given skills, knowledge that are standardized, and he holds on to those skills, knowledge, and values in that particular section or that particular training. And usually this is passed on in a very organized format approach or curriculum, for instance, and it should be approved by a specific body. And why am I talking about professionals? Because if you don't belong to any profession, it becomes very difficult for you to actually to comply with such rules or regulations or code of conduct. So I want to take an example, like the doctors. To become a doctor, like in our setting, you will study for 5 years, and you will have to fulfill all the requirements of that curriculum, of the MBCHB curriculum, just for example. And usually after the 5 years, you'll have to do internship, which is a temporary period for which you are supervised, and eventually you are registered as a medical officer. So when you go through that and attain that qualification, and you do your internship, and you take all these requirements to the Uganda Medical and Dental Practitioners Council, then they give you an practicing license, which confirms that actually you are being trained, you are competent, you are skilled, you have gotten the values that they need for you to be a doctor or a BDS, Bachelor of Dental Surgery. And they will do that, and every year they will be giving you an annual practicing license. So that's just an example, but most of the professions do most of those things. So members of that profession use those skills, knowledge, to engage in a number of activities. Some may be very free, some actually may be specific, some may be very general, and they may benefit the societies, and also themselves. Sometimes they gain their livelihood from the same skills. For instance, doctors, after you've graduated and you've been registered, the law allows you to actually go. No, you guys, mommy, go to mommy. Bye. Sorry for the interruption. My daughter is on my case, but I'm sorry. So we need to go, and you can apply for a job, and you are employed. But also you can do free, like pro bono services to the community and others. But it can be used by you yourself again to scoop some salary from here and there when you have been appointed as a medical officer. Can I proceed? So this one, I usually say that this knowledge and practices you gain actually, they serve the interests of others. That's what we call altruism. Not doing things for yourself. You go beyond yourself to make sure you serve other people, and that is very important. And there are always rules and regulations you have to follow, and they are usually engraved in what we call ethical code of conduct. This actually, for instance, if you look at the public service code of conduct, doctors code of conduct, teachers, prisoners, and then the rest, nurses, the lab people, and then the sports, they usually have regulations. For instance, most of you are supporters of these football clubs, but you see when they are playing and on the pitch and they do anything, you go and attack somebody when he doesn't have the ball, they will penalize you because their ethical code of conduct doesn't allow you to attack. Even when you are playing, it is a fair play. If there's a fair play and then you do something, they will penalize you. If your team over celebrates and then it causes a lot of chaos, eventually they will penalize you. So the same applies to doctors. And we are going to look at it and say that when doctors also have been doing all the best and they go beyond what they are meant to do, the council comes around to regulate them, and they can, in a civil way, although sometimes when you make or you commit offenses that have criminal elements or criminal intent or content, it's actually the police takes over and the courts of law. So always remember that you need to be very cautious that in your line of providing clinical care, you can end up being taken up by police or the regulatory bodies like UMDPC, which can actually sometimes just suspend you or can just warn you, depending on the gravity of the offense you have committed. Or sometimes they can take your documents and say rest for 1 or 2 years and then you come back. Or they can say, oh, we are going to take you to a hospital for an attachment to prove or to learn something extra. So they have all that mandate, and we should be cautious. Now, as already alluded to, these people have values, and we're going to look at the values like doctors or health workers. All health workers should have respect, not even to health alone, even all people. In most cases, if you don't put the patient's interests, preferences, or dislikes, and you don't hold patients with the dignity, actually this tends to cause a lot of mayhem. And I want to assure you, whether they are dead or alive, or even colleagues, patients, or colleagues themselves, and the entire community at large, if you don't respect people, it becomes very very difficult for them actually to accept the services you're going to deliver to them. Equality. We tend to say that we treat all patients equal. But I want to ask one question. I try my level best that whatever I write in the file of anybody with a lower social status, the rich and whatsoever, is the same. But sometimes you write something and then someone says, but I can't afford. What do? You start debating with yourself. The hospital doesn't have, the person cannot afford. What do? Do you go and try to borrow? Sometimes you're not being in position. All things are out of stock in the entire hospital. It puts you at a dilemma, but all the time, try to provide the services, the same services equally wherever you are, either in public, private, where, even to your relatives and the rest. Please always make sure that you are bound to that. Now, what are the cardinal rules of these? Are bioethics, by the way, bioethics, ethics, and then the rest. But these are very important. The four, what do they mean? Autonomy. It is always very important for you to make sure that the interests of the patients, their will, and what they prefer to do is always put in the center of your decisions. And this actually means even when you are clerking patients, or when you are planning to admit a patient, if he says, no, doctor, don't admit me on your ward, admit me on private, please take them through all the integrities and they make a decision. But according to their preferences, if a patient comes, doctor, please refer me to Nairobi to do a PET scan or to do a CT scan or something, and you tell them, but we give the same services, and it makes a preference for the other, please do. Don't hesitate, just continue. And obviously, during medication, be cautious. Always make sure the patient is at the center of decision making, because at the end of the day, if the patient doesn't make a decision, then you will be up in arms. Interventions. So many times I've asked my patients on the ward, they put a chest tube in you to do this. Did you consent? Just themselves told me there's blood there, and then they have to drain. But you don't tell them that it's going to be a little uncomfortable, painful, and then we shall be on medication. Those things are never told to patients. But you find the patients, and sometimes they have not even consented. Even the document is not there. And this is a very big dilemma. So when the law takes us up, we tend to to find ourselves in trouble. Allow the patient to agree or refuse. The patient has the right to take up the medication or an intervention, or to refuse. And even when they are getting out of Malaga and they come back after reaching the gate, and please don't quarrel with the patients. Tell them, okay, thank you. Take them through again. Most likely they might have had other issues that were disturbing them. Beneficence. For all what you're going to do, for instance, if you are going to do an LP for a person who has cryptococcal meningitis, it is very okay. The LP is meant to help in diagnosis, reduce the eye, intracranial pressures, and the rest. But if you intend to harm the patient and you say you're going to do them today, tomorrow, the other day, that should not be allowed, my dear friends. No. But remember, you have an obligation to act in the best interest of the patient, and the best decision that you take should be the best choice the patient has made out of the so many that it benefits them. So you maximize benefit and minimize what? Minimize challenges. Non-maleficence. This one also has another Latin word which usually is written as premium non docere, meaning first do no harm. If, for instance, you can treat somebody with tablets to control pain, you don't need to inject somebody or to use an intrathecal route or something to achieve the same pain, to achieve the same comfort. Even when you're taking history, be cautious. Don't remind people of scenarios they don't want. When you're examining people, don't do harm. For instance, recently I told a young man, catheterize a patient. He just got a catheter and wanted to put into somebody's urethra without putting KY. I was mad, but not too mad. And then I came down, I said, oh, okay, prepare this and blah, blah. If you're going to do an intervention that actually won't benefit a patient, or even when it's going to benefit, for instance, if you're going to amputate somebody, don't cause also psychological trauma. Tell this person, don't tell the person we are going to cut off the leg. Please be cautious. Tell the person we are going to operate the leg. This part is not working properly, and then we need to remove it from a normal leg. And you tell them what you're going to do and what you will do afterwards, losing that part. And you go slowly, because you tell this person in the morning at 10 and 11, you are taking the patient to theater. The person is going through a lot of emotional and psychological stress and distress, but you have not allowed them to concentrate. And the other thing is being fair in your selection. That is what they call justice. Remember, being fair is very difficult to be fair. Sometimes other people, you may think you're being fair, but you're not, you're being unfair. And they always never be discriminatory in all your medical practice. Be cautious. These things here are the biggest challenge we have. It is a duty for all of us to make, for all health professionals to make sure that we give equal access equal access to all populations that we look after to the health services we deliver to patients. Let us move to the next slide. So, confidentiality and privacy. My dear colleagues, it is your obligation or your duty not to disclose patients' information. And it is the right of the patient to demand for our information to remain private. Please, when you are talking to patients, don't say, oh, what is your cell status? When every patient is listening. I don't know, ARVs, even now. Let us be cautious. Let us be cognizant that this is very confidential information that needs to be held with the utmost care of all sorts. And even when you are examining patients, don't tell the patient, remove, undress. The other children are there seeing, and then the adults, different sex are there when you're examining people. Let us use screens and let us be very conscious. If we have private rooms or curtains, let us be cognizant that we don't want anything to leak out. Even when you're operating patients, don't discuss patients' body parts, that either your tooth is a little bigger than what. And you know, when they wake up or when you're intubating, you say, hey, this teeth here, because people listen, oh, this hand here is bigger than the other leg and whatsoever. No, be cautious. These things have caused doctors a lot of trouble. Informed consent. Please, it is an ethical process and a legal requirement for you to make sure that all people you are dealing with consent, because this is a contract. So simple, and it should be in simple language that is understood by the person or the patient, and you should discuss the benefits while you are doing that procedure or something, and also tell them the harms. And then let them don't threaten them, but give them information and see how much you can give them. It should be voluntarily given by the patient, not coerced or not induced. And it can be withdrawn. So it is not that if he has committed for surgery, he cannot change. My dear, no. People can change and then even commit again. And informed decision making for medical or surgical procedures is very key in the training of health workers, in research, and in medical practice. Please, I want you to go back and read these slides and understand them well. Whatever you're doing, you better have them as your clerking patients. They will help you a lot. Remember, whatever we do with the patients, we are held accountable. And I want to give a scenario here for what we call responsibility for our decisions and actions we take, or omissions, either you're in training or clinical care or something. And I want to tell the supervisors or people who are mentoring that there's what we call vicarious liability. Vicarious liability. For instance, Dr. Kabweru has to supervise other colleagues and residents and interns and undergraduates and other paramedicals. Now, if I'm supervising a person giving IV treatment and I sit in the theater, maybe for an anesthesiologist, and this patient, instead of giving ketamine, gives tranexamic acid, and the patient gets fits, if it's spinal, and he dies, I'm reliable for all the problems of this person in training. If it is an intern, he will walk away scot-free because for them they are temporarily registered. If it's a resident, they also rely a bit because they are already practicing doctors and they are coming for further training. But most of the responsibility will go on to me, the senior person who knows that, supervisor, and the hospital. The Attorney General may help out to whatever, but he may refuse to cover you, especially if it's negligence. So let us be very cautious in whatever we do or we miss out. It will always come back to haunt us. Let us proceed. Hoping I have some time. It is always good to tell the truth and know that if you tell patients lies, they will actually just withdraw a lot of things and they will not trust you any longer. But in medical errors, try to be cautious as you break the information and see whether there are frameworks within the institution, there are SOPs to follow, because sometimes this can end up being the cause of litigation. Although I don't also encourage you to cover up medical errors or surgical errors. For instance, there are those ones that are gross that actually even when you try to cover, you will end up actually being uncovered. And there are so many cases of our colleagues who have fallen into sort of this. And you know that if you tell lies, patients will never believe you. For instance, if you told someone that his HIV status is negative, then the next morning someone says, but your HIV is positive. Then what should be the truth then here? So people will lose trust, and then public trust, once gone, it is done. And whatever you're going to do, it won't hold anything. So let us make sure that our relationships are based on the truth. Now, fidelity. It is important to be faithful and committed to your patients, institutions, and profession or principle, or if you are an agent. For instance, if you are told that during this period, be on station and don't do ABCD, and then you go against the institution and you do what they have not told you, they will actually let you to fall in problems and you pay for the damages. But also, you should not be compromised by institutions and you end up doing wrong things. If someone has been, like, for instance, he comes with a fracture, you cannot, for God's sake, so that the patient I saw had the malaria. I think people will go mad and then they'll never forget you. And selflessness, please always remember you are not doing things for yourself. You are doing things for the best interest of the patients and society and the public. Next one. Benja, the next whatever slide. Okay, integrity. Whatever you do when someone is not there is what you should do, even when he's there. So doctors should never be compromised. I've alluded to this. And always be objective in your actions and decisions taken. And they should be impartial, fair, and they should be of good to the patients. Please don't be paternalistic. Don't decide since you think you know it all. Always remember the Hippocratic oath, and don't be biased in your decision and don't be discriminative. Open. It is good to be open, but you need to be a little cautious with the openness. Because sometimes you open and then it scares some other people. Always gauge the kind of person you are discussing with, but it's good to be transparent in the way you handle yourselves. Okay, proceed. Benja, another slide. Okay. Intellectual discipline and standard of knowledge. Now, I think we have alluded to that. Now, this is just talking about how you become a member of any community and whatsoever. But governance is very important. So members of a profession must have a representative body. And I was giving, like, for the doctors, you have UMA, Uganda Medical Association. It is it is for advocating for your rights and the well-being and the welfare and the rest. But UMDPC is to regulate you if you are out of order. Although they are also meant to protect you. So many times they protect the community, but they should protect you. If you look at Uganda National Council for Science and Technology and the REX, these ones are related to regulating research that is related to human beings, although we also have UNRO. And this shows you the elements of a profession. So it may not be necessarily one, but there are very many. They are all very important. Proceed. The next slide. So, legal status. Professional bodies must be legally recognized in the laws of that country. And you know that Uganda Medical and Dental Practitioners Council is under the Act of Parliament of 1998 that established it, and it is a legal entity. That's why it tells you, come here, bring this, do this. And even the courts of law consult UMDPC in case there are cases involving doctors and other colleagues that are within that whatever. They have a code of conduct, and these are very available. You can read through them, and they're on their website, and you need to know them. Now, service provision. We know that they exist by solving individual, societal, or public. And they also give services as expert opinion in the different cases. For instance, if you are a National Council for Education is establishing a curriculum for any training, they usually call the UMDPC to ask for their opinion, although they also come back and then call some of you who are here to give that expertise. So in that way, they work as a basis of making sure that whatever they are going to teach the people in that profession is actually in tandem with what they need to know. And by the time they get the product, you are up to those members that should belong to that profession. We proceed to the next slide. So where are the sources of ethical dilemmas? Information gathering. During the time you are clerking patients, it should be adequate and accurate. So many times doctors have been gotten on left-footed when the patient has passed on them and they have nothing. And they run away, and the police calls them, you come and make a statement. And they have no statement, even in courts of law, and they end up in jail. Capacity to consent. Remember, the person who should consent should be of age. In Uganda, we talk about, in normal services, we talk about 18 years and above. When you are doing organ transplant, it's between 23 and 25, because that one has a lot of connotations. And then the elements of consent. You should remember, you should use the person's best language so that they don't get barriers. And then remember that somebody should be in a normal capacity or competent enough. And if they have diminished or vulnerable state, for instance, if someone comes in with alcoholic coma, they shouldn't consent, my dear, my friend. First resuscitate them, make sure you put glucose, those things, blah, blah, IV fluids, the patient stabilizes, and then they consent later. And then you tell them, what you did for them to wake up. But although vulnerability is a little different, because if there are power differences, some people are very vulnerable, they can easily say yes. For instance, if you have been paying for somebody from senior 1 up to university, and you get a kidney failure and you want that person to donate, he's already vulnerable because he fears to say no. But then it is their life. They can say no. You do not make a contract that after I'm paying for you, you have to give me your kidney, because it's meant to be free. So you should know those things. Patients' rights, that they have to accept, they can afford to accept, and they have a right to refuse either treatment or intervention or anything. This is where I usually get a big challenge. So we have the obligation or the duty of care, which we should provide, but the patients have the right to refuse or agree. Disclosure of information should be adequate. And to who? Next of kin, try to avoid third parties, my friend. When you go on a radio station and say, Kabweru has fever, has a running nose, what? Please, you're not meant to tell the public that I have a running nose. They start thinking, why is he having a running nose? And for sure, is that very important? And then next of kin, for married couples, always consider the spouse as the next of kin. Or if someone has elder children or old children, if they are not there, you go to the parents. If they are not available, then you look for the siblings. If they are not available, you look for relatives who are close. If they are not available, friends. If not so, you look for the legal guardians, those that are being appointed by courts of law, or those customary guardians, either heir to their father or somebody. So you need to follow those things and ask the patient. In this country where we don't have advanced directives, it becomes a dilemma, but it would have been the best. So otherwise, you can follow some procedure of that. Documentation should be timely and not waiting for authorities like police to tell you that you come and give us the file, fill in the file. And my friends, it is good to refer patients properly, not to divert patients that, to see me from Lago. No, go under the other mango tree and I find you there. No. If a patient don't refer patients or patients private or when against their will, or don't coerce or convince them. Let the patients actually know why they are being referred. Either you can refer if you're escalating care, or you can refer when you are de-escalating care to lower facilities. We proceed. We're almost coming to the end. Sorry, my colleagues. Benjamin, we can proceed. Oh, so infrastructure. Sometimes be cautious. The physical buildings you have, can they support the services you are giving? For instance, you say you're a specialized hospital, but you see you have one building which has a lab and everything, and you don't show anything, even human resource you don't have, and you don't have a specialist. Even your services, you said you're going to do OPD, now you're doing inpatient and other things. So this can cause you trouble. Individuals and then facility licensure. You're saying you're a specialist, but you don't even have APL. You don't have even premises, those suitable whatever's for your premises, nothing. And then you are pretending. The status and level of services. If it is a daycare, don't admit patients. And if you are unable to look after patient, because this is where our colleagues have been held responsible. You say you are a daycare service, and then you start admitting patients. You don't have monitoring tools, nothing, no documentation, and what? And you end up actually in trouble. And then you start saying UMDPC is bad. But it is meant to put you to line where you're meant to do your best. And level of human resource for health. So if you say you're a specialized facility, make sure you have. I want to take an example of Mulago National Referral and Specialized Hospital. They have different units. And like for me, I'm in CTS, other people in GI, others are from hematology and the rest. You should know that actually you need to have that. So skills, knowledge, experience, practices, competences, and attitude are very important. But if you lack them, you are in big trouble. So the services you provide should be patient-centered and should be based on shared decision making by the entire teams, not you alone as an individual. When do you override patients' interests and preferences or all rights? And you do paternalism. Sometimes when the court asks, but be cautious when the court is asking, you should document through the director of the hospital and then to you. Don't just divulge the people's because the court has said no. Court orders have to go through right channels, and don't give them unimportant information. Give them relevant information. I'll give you scenarios where a patient actually came with an injury, worked upon, and then 6 months later he comes with the complications. But in our operative notes, they were not there. So I couldn't just change a medical report. Never. So I guided this person to be seen by another specialist who can assess the level of injury and document the disability and even fill a compensation form. So feel free to whatever. Third parties, emancipated minors. If, for instance, someone is staying on the street and is less than 18 years, they can consent for their their services because they are responsible for their bills and everything. And if it is a state, please, if a policeman brings a patient, don't mind for too much. Do what you can do best and then follow through the structures of the institution. If it's Mlago, you go to the director or the other senior colleague and then your supervisor or something so that you give the patient services or the hospital administrator. If it's government, don't question too much. If a government says do this, please try to weigh through and then you see whether it is within the frameworks and do what you're being told. If you can't, disclose and you exempt yourself and then allow them work with others. We have said that consents are contracts. If you admit a patient and you disappear or you do surgery and disappear, you are liable for whatever happens. If you give wrong treatment to a patient that does not consent for it and he gets complications, you are going to pay for damages and special interests. Procedures, please make sure you're available unless if you are not there. Communication. Now, communitarian versus individualist consenting process. In African setting, it's like when you're going to Kwanjula, you're going to introduce your pattern. You cannot make a decision on your own. The same applies when you're going to treat people. Ask for who has to give you consent, especially if the patient is in pain. Don't allow the woman to go in second labor and then you say, please give consent here. That will be coercion. Misinformation. For instance, organ trial. You have heard of organ transplant in the country. But people have been saying, there's a lot of organ theft, whatever, on social media and whatever. Try to give people right information and you avoid this kind of misinformation. There's fear of unknown. Sometimes you want to admit a patient and the patient says, how much will it cost? Hey, blah, blah, we hear this and the other. Especially in private settings. If someone doesn't have somebody who is going to commit for their cost, sometimes it's very difficult for them to make a decision. So give them time, engage them, and make sure that actually they know the cost. Don't just admit someone for 2 days. I saw a certain hospital, they admitted a patient for 2 days after chest tube insertion, they asked for 10 million. And the patient complains up to now, but I would leave it at that. So be cautious what you're doing. The right to life or die. Patients have a right to die, and they have a life. I have a right to live. Remember that whatever you do, give adequate information, share with the relevant people, and failure to document properly will cost you. Next slide. So, what are the available legal frameworks? We have family conferences, ethical consultations, and peer-to-peer consultations, and this should be documented. And sometimes, if you talk to experts, let them give you their opinion, and then you make a decision. Hierarchy of next of kin, I've just alluded to that. You should know who is the legal guardian, customer, and then the appointed guardian, and then the customary guardian. And then you know the level at which police can help, especially matters regarding family and child protection. They are very key. Advanced directives. These are wills. These are living wills you make when you're still alive. That if I fall sick and I develop a cardiac arrest, please don't resuscitate me. And you should do it when you're in incapacity, so that by that time comes, you are able. Most hospitals should have hospital and the clinic ethics committee. There's none in this country with that. And I think it is high time we had to allude on that. And obviously, accountability and vicarious liability, as alluded to earlier, you need to know that the individual institutions, departments, agencies, they are liable to a certain degree depending on the gravity of the of the offense committed. Documented loss of now, if you like amputate somebody's leg, please, it shouldn't be you, the surgeon, to throw away somebody's leg. Take to the pathologist so that the pathologist says, I received a left leg, blah, blah, blah. He documents, and even they give you, was it sick or something or what? They do histology tests and the rest, and they give you a report. But don't apprehend somebody's part and then you throw it. It may be mistaken for having been stolen or trafficked somewhere. Discharge. These are very approaches. Request to go home, or you can even request against any medication, but he has also a right to come back and continue. Let us proceed to the next slide. So I want to thank you for listening to me and for the support you gave me. And I'm serving you as Vice President of UMA for God and my country. Service with honor. Thank you very much. Over to you, Benjamin. You are going to help me get those questions in the chat, and also give people a voice to listen to me. Thank you very much for God and my country. You are my efforts and energy and zeal to continue serving you. May God bless you. Sorry for taking long, but this is the pertinent topic that I have a lot of interest. Thank you very much. Over to you, Mr. Mukembo, moderator. I can see 302 people logged on so far, and I can see a lot of appreciations. I really appreciate. I'm humbled and honored to be presenting to you, my colleagues. Over to you, Mr. Mukembo. Joseph, I can see you, and so many other. Lydia, Tumuhimbise, Ocheng, and Izie. Oh, God bless you all. Thank you. Over to you, Mr. Mukembo.
Thank you very much, Dr. Wilberforce. And again, great thanks to you members that have been following right from the start until now. Mr. Desmond, kindly keep resharing the registration link in the chat box. Those of us who need CPD points accreditation, Busoga Health Forum is accredited by UMDPC, Allied Council, and also Nurses Council. Kindly follow the registration link shared in the chat box and register your credentials, and surely we will upload your CPD points after a few days from today.
Just
kindly
a moment
note that
CPD point. Maybe you can
yes,
make
please.
that comment to ensure that they make it correct with the capital letter and without dashes or spaces in the link.
Yes, that is for emphasis. I'm sure the doctors, I think, may be knowing because they have been at least big members of CPDs. But to those that are registering for CPD points for the first time, kindly note that please register with the name that you correctly submitted to your council. And then use the number, the registration number that your council gave you. Please do not give us any other number and then you claim for CPD points. Then too, as you write that number, kindly, correctly write that number with the first letter and don't put a dash. The first letter should be capital, followed by the numerical numbers of your council without a dash in between. And as you register, please use the correct email in case we are to give you feedback and in case your council needs it. And also to remind you, this is digital. It's only those that have e-accounts on the portals of their councils that will get these points accredited directly to them. If you're a nurse or you're a clinic officer and perhaps you do not have a registration with your council, digitally, we can still sign off your CPD points in your book, but that means you'll have to look for Busoga Health Forum and then office, and then we sign it for you physically at our offices because we can't trace you online. So that's about CPD points. Once again, Dr. Kabweru, thank you for the presentation. I had, we had recently, just last month, an ethical issue. Like you were beginning your presentation, you noted that even if it is a thief or somebody who has just robbed your car and you're a health worker and you are driving to your health facility and then is beaten badly by people around, if you reach your health facility and they bring this thief to your health facility, ethically and professionally, you forget he was trying to steal you and you begin treating that person properly. And that is the same scenario we had here recently, where some thief broke into our doctor's residence and sadly he was beaten. And as we came to emergency, the thief was already at emergency, brought by police. And our colleagues had now come again to to work, and they find the thief there waiting for them to work. It's perturbing, but professionally, you must attend to this patient. He's now a patient under your care. He is not a thief in your presence. So that is how ethical dilemmas can take you, that somebody can mean to take your life, but they still need your care, and you must attend to them. You resuscitate them and maybe take them to court. Thank you, Dr. Wilberforce. Ladies and gentlemen, in the interest of time, I will allow 5 members to unmute, and you raise your hand and we'll unmute you if you can't, and then you ask your question, if you have any, directly to Dr. Wilberforce. Thank you. Anyone with a question? Meanwhile, there was a question, Dr. Wilberforce. There was a member who asked you to clarify for her what are values. I think it was Mr. Lutaro. What do you mean by values? Dr. Wilberforce, you can respond to that directly.
Values, actually, they are like things you could I say you weigh towards something, and we know we have value systems. For instance, if you called me and say Kabweru Wilberforce, I may not mind, but if I called my teacher that yes, Mr. So-and-so, or just so-and-so, without that connotation of doctor, sometimes people are uncomfortable. And then the other thing is how you rate something. Is it of value, or is it of any importance, or it is less important? For instance, what do I say values here? I expect a doctor to know that actually before you talk to a patient, you address yourself. You say, my name is Dr. Kabweru. I'm a surgeon, and I'm going to be talking to you. What is your name? That may be value. If someone says, oh, he introduced himself. But sometimes people just come and they start wanting to rap. You not actually build that rapport between you and the patient if you don't make those small things. I have had a number of responsibilities I've had, but one of the biggest challenges I've had is the patients who are high profile. And when I reach, sometimes they say, oh, we are thinking you are a big man, tall or huge and what, and then you are just a tiny. Some patients disclose and say, oh, we thought you are big and tall, and they laugh. And I say, yes. So when I'm introducing myself, I say, I'm Dr. Kabweru Wilberforce, and I'm a senior consultant. I've come to see you. So if you're expecting someone big, fat, I'm me. I'm 62 kilograms. So sometimes they are uncomfortable, sometimes they are good, but the way they attach, they attach Dr. Kabweru to some big, tall, huge person, or the way you behave can actually also drain. So it is always very good to hold people's values or what they consider important. Important, sometimes for you it may not be important to you, but it is. Because through those values, how they were brought up and whatsoever, which culture they are from, that's how they weigh whatever you're going to talk to them. So if you don't regard them as important, it also impairs the way you're going to build your PR with that person. And it may fail. Sometimes you have had patients say, I will not go back to see Dr. Kabweru. He did not have time for me because I did not value that creating time for them is important. Or I had other diverting things. And people say, I will not come back. The same applies to relationships. Sometimes you are doctors, you are very busy. You go home 20 day every time, you're running away from home. By the time you retire, actually, people, they say you're a doctor of patients, but you at home, you're worse. So because you failed to know that you're actually creating that important time at home was a value that was being looked at by so many children and so many others. You saw my daughter running to me. She did not know that actually I was making a presentation in the next room. But when she realized, the mother picked her and they went to another room. And they apologized that but they are always knowing that our dad is a doctor and he talks on Zoom and also. But if you don't grow up knowing that, they will not value that. They say, why are you always ignoring us? So there's something you consider important for a particular reason. And it depends on how people are brought up, which culture they come from, and what attachments are up to those particular points or actions or and things they value. Over to you.
Thank you, Dr. Wilberforce. Yes, several ethicists have also written a lot of information in the chats about values. I saw a comment from our board chair, Professor Peter Waiswa. He also gave a description of what values are. The chat has a lot of interaction. Mr. Balina Moses, you made the sarcastic comment whether the patient on waking up realized the doctor is caring for him are the ones who he attempted to steal from. Definitely when they wake up, they always realize you are the one they wanted to steal from. And what follows, they look around. If there is no police officer, they run away. But via ethical lines, you are supposed to treat that patient. He's not a thief in your hands, he's a patient. Treat them and then handle the criminal issues later with the police. I am sure this has happened to many of us in our fields of work. Then somebody made a political comment about Bariomos. Yes, Mr. Tumusime agree. Whatever you speak, whether you were as long as you speak them in the line of professionalism, as long as it breaks our ethics, our code of conduct, it becomes unethical. It becomes unethical while as long as you are speaking them in the umbrella of being a health worker. It is contextual for Bariomos, whether he spoke as a politician, whether he spoke as a doctor of BSJ. Unfortunately, I don't think he's his doctor. But BHF is apolitical. We don't engage ourselves in political issues, and we wouldn't want to go that side. But the letter I had recently is not an active practitioner of medicine, and I doubt whether he's an active member of UMDPC. So UMDPC may not have power to summon people who are not registered with it, I mean who are active members. But again, as I said, we are not politicians to engage in their discussion. But the learning point from it is that as a doctor, as a health practitioner, you keep your patient's records concealed. It is your business between you and your patient. Whether the one asking for the information is the husband, please keep that information to yourself unless the patient gives you permission to divulge that information in the best way you can divulge it. Again, thank you for that insightful information that you brought up in the group. Mr. Martha, this Martha, yeah, you wrote in the chat, a patient with severe substance misuse, delirium, was surrendered to the mortuary alive. Family picked him up, took him home, still unwell. What was that? What was that ethically? What was that ethically? I don't know if your inquisition is clear. I don't know if Mr. Kabweru, you got that inquisition.
Maybe I can just give my experience. That actually sometimes patients have been declared dead and they reach mortuary, and then the mortuary people, the morticians or the pathologists tell you this person is still alive because they weren't assessed well. It also happens with the babies who are delivered with severe birth asphyxia. It can happen. You may think it is a fresh stillbirth, and actually end up and the pathologist return the baby and say the baby needs resuscitation. And I think some of those have ended up in courts of law. A baby purported to have been taken from hospital for mortuary. He reached home, he was still a little warm, breathed last, and they were brought back. This happened recently in one of the facilities. So we need to be very cautious. And these days, we have a lot of gadgets, diagnostics that can help you assess whether the person is still alive. So you need to be very cautious before you say that someone is dead. You need to be cautious and you need to be very sober. Recently, I met a patient whom I assessed and told me he had a mastectomy, and the doctor thought the patient had cancer of the breast, and it wasn't. And it's not true, but you see, we are also exposing ourselves too much. We need to take a lot of precaution when we are doing some of these things. And then someone asked, doctors take pictures in theater. Please, pictures that are taken in theater are for education purposes. And you should not take them with identifiers. Don't take someone's face and don't, because you are most going to take those patients' details and then you share them, and it's unethical too. You may share them with relatives. Just imagine seeing your mother being half naked in theater, and then you get uncomfortable. It is illegal, and they can sue you, but it's also very not allowed anywhere, not allowed anywhere as in practice. And it would cause a lot of ethical dilemmas if they don't even suspend you and even sue you for malicious damage and exposure, breach of confidentiality. And remember, it is their right as patients to keep private, whereas it is also your obligation to make sure that actually you keep this information or somebody's unclosed body to other places. So be cautious. But if you take a lesion and make sure someone cannot be identified. Try your level best. Even when you are collecting information, make sure you anonymize. Label patient X, 25-year-old female, and end there. You can use initials and whatever, but you can even use other letters and you define them later. Make sure you don't disclose. Thank you.
Thank you. Thank you, Doctor. We are winding up our presentation tonight. This is a common scenario. Mr. Anguzu William asked, how do you go about patients you meet in OPD? You do your investigations and immediately this patient makes a phone call to his or her own healthcare provider outside who isn't at the facility with the patient. This is a common thing to many of us. Patients have a right to seek second opinion, and they have their autonomy to receive your intervention or treatment. But you also have your discretion as a doctor to let the patient go and get that treatment where they feel they are best served. You can let them go, but you can't refuse them to have their autonomy. Perhaps, Dr. Kabweru, you want to add something? This is a patient in your care, has come to seek care. You are giving information, but perhaps they don't want to trust you or have trust issues. There are these .com patients who come and they're in your office, they are busy Googling about their condition. And when you give your professional advice, they feel you are insufficient. It is now Mukembo who is an MO. They feel they must first call senior consultant Kabweru to first accept your advice before you initiate it. What is your say, Dr. Wilberforce, about such patients?
I want to give scenarios. I'm small in size, and patients have met me with my SHOs who are very fat, and they say, but the other doctor told me, don't argue with the patients. But it is the onus of the other doctor to tell him that, this is our colleague, senior colleague, and we are seeking for a second opinion, and we want to make sure that you are fine. So sometimes what doctors do, or other colleagues, they say, that one doesn't know. And this is very bad. You are saying that one doesn't know, but someone actually knows. We are not trained in the same school. We are different schools. Someone trains from China, one Makerere, one another place. Because the school, you different school thoughts and then different thinking and different practices and things. But we know there are some that are cross-cutting. So always respect what a patient feels like. You allow them consult. Recently, I had a patient who came to see me, and he said he had met this doctor, blah, blah, the other. And then eventually I told them, but what was
Gula
your
ukiwa
comment?
rasmi ama no?
Dr. Kabweru, you're mute. You're speaking.
Hey, sorry, someone muted me. So sometimes you need actually to allow people consult their primary doctors, whatever level they are. If that doctor is good, you'll say, oh, I may have been called by doctors across this country when they are referring patients. Sometimes I tell them, no, don't refer. Do ABCD from that facility. Then they say, oh, we don't have the capacity. And they say, oh, if you transfer to Mulago, then are they willing to come and whatsoever? But sometimes you're seeing a patient, is on Google and whatsoever. You give them time. Sometimes you tell them, okay, can I see you another time when you have consulted your Google and then other colleagues and you have come up with a consensus? Especially government patients are very good. If they are looking for you, they look for you. If they are not interested, they are not interested. But it is their choice. If they need you at time T, they will. Even senior doctors, our teachers have consulted us and we have helped, but not backbite your colleagues, because that is the biggest problem. And the patients also eventually they get also referred through your clients. If you have attended to your patients very well, sometimes those patients will send you more. Or students you have taught, or colleagues you have worked on their patients. So sometimes you have to give that allowance and remain flexible. That's what I would say. Thank you.
Thank you very much, Dr. Wilberforce. Peter in the group made a comment. You have a patient who you seem to have a conflict of interest with managing. Is it okay to ask a colleague to come and attend to the patient? Yes, Peter
Okay.
Prila, that is ethical. Okay. As
Yes.
long as you think you are conflicted in managing that patient, it is ethically fine to ask another person to handle that patient. It's the same thing to do with your relative. Same thing to do with somebody you are close to. You might be the best person, but you might err on either excessive intervention or under intervention on the side of sympathy or empathy. So it is better if you think you are conflicted in managing that patient, you can step aside and allow another independent mind to treat that patient. There is nothing wrong with that. And there was a long message I want to end with, which came from Mr. Peter Nassan, where they had a teenager who had RTA, was irritable, removed the cannulas. Night team had chased him away. He went out and sleeping under a mango tree. On arrival, watchmen approached him with concern. It's quite a message. Anyway, there is no question in it, but it was a message. I don't know what you wanted to communicate, Mr. Peter. You could unmute in case you want to communicate something. Desmond, you want to say something?
You have some two hands from Kasibante and the Winnie. They have really put their hands up for all. Yeah.
Oh, I wasn't seeing them this side. Maybe you were seeing them. Well, I will end with those two hands. Mr. Kasibante, please unmute and ask your question. Thank you.
I think we can have Winnie.
Okay, let's have Winnie. Kindly make your submission. Thank you.
Thank you very much, Dr. Mkembo, and thank you, Dr. Kabweru, for the insightful presentation. I feel it was very timely and highly needed for all of us. My question is, as Dr. Kabweru, as the president for the vice president for the Uganda Medical Association, what plans do you have and your team to be able to enhance or improve these professional behavior and ethics amongst the doctors? As I ask, I'm just reflecting about the recent woman leadership elections that that were organized, and there was really a lot of arguments, disrespect amongst doctors and also other professionals. And these were actually inciting from many senior leaders and even associates. And also the elections that happened in Barara, they really portrayed a very bad image amongst, the doctors and a lot of cares. And so many times I wonder, what are we, setting, what are the young professionals really copying from the seniors or the people in leadership? So what do you have in plan to be able to encourage these good values of respect, integrity, professionalism, and quite a number of those that you've talked about, and to the young professionals? Thank you very much.
Thank you very much, Winnie, for that good question, timely. I just want to give some response that as UMNEC, when we went into power, actually, our first retreat, we had corporate governance training, and I think it might have helped a number of people here and there. But myself, I've done MBA, and I did corporate governance for actually 3 months as a course unit. And maybe what I can say that we can actually have some engagements with other corporators so that people pick up a leaf. But I think also time to come, I'll make a presentation about ethics and leadership, because I'm the chairperson for National Bioethics Committee in this country, and I know there's ethics everywhere, but ethics and leadership has a lot of interesting things. I may source out for one of the leaders, and he gives us that talk, or we can work on it as UMA. But also as UMA, we are planning to organize a branch empowerment and capacity building in a number of areas, but one of them, corporate governance, is very key. And if you looked at my campaign, small manifesto, I was looking at the attire: accountability, transparency, trust, integrity, and then responsibility, effectiveness, and efficiency. So I think we are going to make it a point that actually we reach out to our colleagues, and they should know that whatever happened for a reason. Sometimes things happen, and always I say that failure is part of success. It is a step. When you fail at point 1 at Imbarara, then you hold a good direction. Then you pick from that leaf and bring in another better standard or value at a time T. So it is unfortunate that happened, but it happened for a reason, and I think we're on the trajectory to improve the brand of UMA and then our colleagues. Now, supporting colleagues who have been litigated, who are actually unethical. Actually, the council is doing a lot of work, and they have a committee that is responsible for that. But I think as UMA, we can work around with the council and reach out to the different doctors in the different settings, both in public and private, so that actually we highlight these issues that actually can be a source for either our bad behavior or something. And it can end us actually in courts of law, or can end us being expelled from our practice by the different regulators. So I think we need to do some homework and reach out. Thank you, Winnie.
Members, I want to thank you once again. We have spent long on this topic. I mean, there's been a lot of learning, especially for those of us who followed from the start. I request that we end it here, the discussion, because we are out of time. However, if demand be, we can arrange another session on ethics and professionalism. I've seen leaders from Uganda Nurses and Midwives Union in attendance. We thank you for joining in. Please, if you have something to present in line with the nurses or other health workers, kindly reach out. We shall give you a podium and you present. I've seen leaders of allied health workers also online. Please, we are open. If you have a presentation, kindly let us know. We will arrange for you in advance. We will have a range of topics that we shall be coming up with every Friday. Please be an active participant. That flyer on the window on your WhatsApp indicates our membership fees. We ask for a minimum of 100,000. I don't want to say 100,000. If you can afford even $1 billion, Busoga Health Forum welcomes all partners. You can come in with a project and you want to partner with us. We are welcome. We are open and we shall be supportive. You might have a research project and you need research assistance or you need a community entry. Please contact us. We are willing to help you if you are going to do some of these projects, especially in the Busoga region. We usually have camps, medical camps, like we have volunteer camps for ear, nose, and throat conditions done for free by one of our senior consultants, Dr. Busoga. He does this for free every end of the month, the last Fridays. So you can see we have a lot of community activities that need financial support. Kindly be an active member by subscribing to Busoga Health Forum. You may want to pay life membership. It's just 1 million and you will get that beautiful certificate and join the life membership committee of BHF. Or if you are an organization and you want to be part of us every year, please, the subscription is only 500,000. Whenever we have activities that require physical engagement, you'll always be on the invitation list to be available, and you'll always pitch a camp somewhere to do your activities. And we always recognize you at our annual conferences. So please come and be part of us, not as a passive participant, but as an active member. Ladies and gentlemen, in the interest of time, allow me ask, I don't know, Desmond, is Professor Peter on?
Yes, Professor Peter is here and he has the honor to close this session as the board chair.
Fine. Professor Peter, it's a new year. Kindly say hi to our members and as well wish them a happy new year. Thank you, Professor.
But remember, to just a comment to Professor, we've had 340 people on this call today. Thank you.
Wow. Thank you so much, Dr. Mukembo, for chairing, and Dr. Kabweru, who says is vice chairperson of UMA. I think today you are a founder and a member of Busoga Health Forum. Then you're a vice chairperson of UMA. Thank you for wonderful stuff. Without ethics, there is no healthcare. And our society, unfortunately, we've just seen the decay in the society. So what was happening during elections, I think we need to teach ethics everywhere. And that session is, I think, Uganda Medical should do team up with the others, Winnie and your team, with the nurses and others, and because the ethics is basically the same, is to first do no harm. So it is the same everywhere. We should teach everybody, and health workers need to be ethical. But unfortunately, there is a lot of unethical things even among consultants, especially things to do with money and the medical procedures. But as you said, ethics is also leadership. But I'm not going to give another talk. I thank you for an excellent presentation. And I also thank Benjamin for organizing and for members for all the 340 for attending. So Dr. Kabweru received a certificate of appreciation from your own organization. Thank you so much. And come back again and talk about leadership and ethics. Dr. Robert Mukembo, who is also a member of Busoga Forum, and both of them actually are members of the CPD committee. You had a good start. Let's push it. To everybody, and see you next Friday. Have a great weekend. God bless. Bye-bye.
Thank you, Prof.
Thank you very much. Prof, we are humbled to have you, sir.
Sir, I was your student today.
I'm very humbled. Thank you for teaching public health, and it made me different, sir.
Thank you.
So it is a student appreciation. Yeah, ladies and gentlemen, at the Busoga Health Forum, we have that free interaction. Such audiences bring you closer to your trainers, your lecturers, your mentors, and your mentees. That last interaction has showed you Professor taught Dr. Busoga public health, and Busoga also taught something. So that's where we are. We welcome everybody. Kindly always join us. Our WhatsApp groups are open for daily interaction.
Dr. Mukam, you can tell people about this. Those who are here.
For those who are still online, our topic for this month of January was supposed to be about health system strengthening for professional practice. And that's where we shall be delving. We shall push it concurrently with the public health and preventive medicine. We will push them concurrently through this month of February so that we are able to catch up with our work plan. We were trying to re-strategize the whole of January. That's why we didn't have CMEs, but we have come up with that good work plan. As you see, we will share it on our WhatsApp groups, and in case you to make a presentation, we shall schedule you on any Friday in those months. But we are flexible, as we said. If it means having presentation twice, and in case you want to volunteer to present, please let us know. But this whole month of February, we shall delve into strengthening of health systems and then public health for prevention of diseases. That's where we shall be delving a lot the whole of this month. Once again, I want to thank you for joining us and invite you again to join us on Friday again, 8 p.m. next week. It's a pleasure having you. Have a good night and a wonderful weekend. Thank you.